everyone, welcome to the Medic World Study with Dr. Mahi. So today we will discuss the questions from INICET 2023 of Orthopaedics. So let's discuss the first question, that is a 25-year-old male who sustained a shoulder injury presented with swelling around the shoulder joint. An X-ray of the shoulder joint is shown below, which is or are the ligaments likely to have been injured. Here in the image, it shows the clavicle has moved up and there is a gap between the clavicle and the acromion, suggesting injury to both acromioclavicular and coracoclavicular ligament. So the answer to this question is both acromioclavicular and coracoclavicular ligament. Now let's move towards the other question, that a 14-year-old male presented with a mushroom-like tumor in the distal femur for the past 2 years. Which of the following features will help the clinician identify a malignant transformation? So first of all, we have to identify the tumor. This is the tumor, mushroom-shaped tumor. We can identify it. There's a well-defined exostosis. We can diagnose it as osteochondroma. And we all know that its malignant transformation can be identified by the growth of hyaline cap. That is the cartilage, growth of cartilage, and growth of cartilage is seen on MRI. So the answer to this question is hyaline cap thickness on MRI is 2 centimeters. Whenever this thickness of hyaline cap increases to 2 centimeters or more than 2 centimeters, then we can say it is transformed into malignancy. Now let's move towards the other question. That is, a 16-year-old girl presents with multiple swellings and multiple brown rashes, multiple swellings, and multiple brown rashes. She has increased uptake on bone scans over femur, skull, and ribs. Biochemical parameters are abnormal. She also has a history of hypothyroidism. An X-ray of the femur is given below. What is the likely diagnosis? First of all, let's see the X-ray. Here in the X-ray, we can see the Shepherd-Crook deformity, which is seen in fibrous dysplasia. And according to the question, we can see there is multiple brown rashes, means cafe ole spots. These are the multiple brown rashes. He also has a history of hypothyroidism, plus biochemical parameters are abnormal. Okay, so all these clinical features plus X-ray showing Shepherd-Crook deformity suggestive of fibrous dysplasia points towards the diagnosis of McCune-Albright syndrome, which presents with the triad of cafe au lait spots, polyostotic fibrous dysplasia, and precocious puberty. Now let's move towards the other question. A patient came to the emergency department with a history of RTA, road traffic accident, and a shaft of femur fracture. Okay, the patient is stabilized. After 12 hours, he developed sudden breathlessness, confusion, and petechial skin rashes over the chest and axilla. What is the probable diagnosis? As per the given clinical scenario, we can diagnose the case as fat embolism because after 12 hours of long bone fracture, it presents with sudden breathlessness, confusion, and petechial skin rashes. It points towards the diagnosis of fat embolism. Let's move towards the other question, that is choose the true statements. The first statement is the most commonly fractured carpal bone is lunate. It is the false statement because the most commonly fractured carpal bone is scaphoid. The next statement is the scaphoid is the most commonly fractured at the waist. Okay, this is the correct statement. The next statement is the cast of the scaphoid fracture is set in a glass holding position. It is also the correct option and the correct statement. And the last statement is Kienbock's disease is due to the osteonecrosis of lunate. It is also the correct statement. So our answer to this question is A, that is 2, 3, and 4 only. Let's move towards the other question. That is, what type of gait will be seen following a fracture in this region? First of all, we have to identify this bone. This is our fibula. We all can identify this bone as fibula, that is the lateral bone of the leg. It, the arrow is pointing towards the neck of fibula, and we all know that around the neck of fibula there is a nerve called common fibular nerve. If there is injury around the neck, there is a nerve called common fibular or peroneal nerve. So, if there is an injury to the neck of fibula or there is a fracture here, this nerve can be damaged, and due to the damage to this nerve, this gait which we are getting is the high stepping gait. So the answer to this question is B, that is high stepping gait. Let's move towards the other question, that is true statement about Bankart lesion. We all know that in recurrent dislocation of shoulder, recurrent dislocation of humeral head, just imagine that this is the glenoid labrum and this is the head of humerus. In case there is recurrent dislocation of this humeral head from this glenoid labrum, there is injury in the glenoid labrum and also in the humeral head. So, the lesion which is formed in the humeral head is known as Hill-Sachs lesion. We can learn it like this. H and H stays together. Humeral head has Hill-Sachs lesion and the other one, that is Bankart's lesion, is present in the glenoid labrum. So we can eliminate two options from here only. Bankart lesion means it is in the glenoid labrum. So the third and fourth option is cancelled. Now, it is present where? Anterior-inferior or anterior-superior? So, the answer to this question is anterior-inferior part of the glenoid labrum. We have to learn it, okay? And Hill-Sachs lesion is present on the posterior lateral part. Now, let's move towards the other question. Hawkins classification is used for which fracture? Hawkins classification is used for fracture of neck of talus bone. So the answer to this question is A, that is neck of talus bone. Now the next question is a female patient presented with swollen and tender joints. There is symmetric involvement of female patient and with swollen and tender joints, symmetric involvement of multiple joints such as wrist, hand, and feet, which is bilateral, along with morning stiffness lasting for more than 1 hour. Erythema is absent. The most probable diagnosis. All of the clinical features points towards the diagnosis of rheumatoid arthritis. So the answer to this question is rheumatoid arthritis. Now the next question is a 45-year-old patient with a tibial fracture in a cast presented to the emergency department with complaints of intense pain. The cast was removed and on examination, passive extension was painful. The dorsalis pedis and posterior tibial pulses were present, and there was a loss of sensation over the first web space. All these clinical features points towards the diagnosis of acute compartment syndrome. Now, what is the next step? We have removed the cast. The cast was removed. Now, as we have diagnosed, or we are suspecting the case of acute compartment syndrome. So the next step is to measure the pressure of anterior compartment. So the answer to this question is option C. Now the next question is 3-point bony relationship of the elbow will not be damaged in. Answer to this question is supracondylar fracture of humerus. Because the 3-point bony relationship of the elbow is disturbed in all of the following. In elbow dislocation, it is disturbed. Lateral epicondyle fracture, it is disturbed. And intercondylar fracture of humerus is also disturbed. Let's discuss the previous year questions from INICET 2024 of Orthopaedics. So the first question is, which of the following layers is affected in Salter-Harris type 1 fracture? Salter-Harris type 1 fracture is a transverse fracture through the hypertrophic or calcific zone of growth plate. The growing zone of the physis is usually not injured and growth disturbances is uncommon. So the answer to this question is option C, that is calcific layer of growth plate. Let's discuss the Salter-Harris classification just in a one go. First of all, there are 5 types: 1, 2, 3, 4, and 5. We will learn it by a mnemonic called Salter, as the name in the classification Salter. S for straight, cross, or slip, that is the type 1. Type 2 is A, that is away. Type 3 is L, that is lower. Type 4 is TE, that is through everything. And type 5 is ramp or crushed. How we will understand it? Thus, straight across means it is a transverse fracture through the growth plate. Okay. A is away, means fracture lies away from the joint. A fracture through the growth plate and the metaphysis, sparing the epiphysis. Okay. Now L. L for lower. The fracture is below. Below means lower. The physis and the epiphysis. And type 4 is through everything. Means the fracture passes through all the three elements, that is the bone, growth plate, metaphysis, and epiphysis. Means all the three elements of bone, that is growth plate, metaphysis, and epiphysis. And type 5 is crushed, means it is the compression fracture of the growth plate. We have learned this. So from this table, we can solve the question, this question, and other questions like this. Let's move towards the other question. So before moving towards the other question, we have to understand the management of fracture neck of femur. because it is most commonly asked nowadays. So, if a question asks for fracture neck or femur management, we have to first see the age of the patient. If the age is less than 65 years, then we have to see the age of fracture. If it is the patient has come to you within 3 weeks, means less than 3 weeks age of fracture, then we will do closed reduction and internal fixation. And if the age of fracture is more than 3 weeks, then we have to do the MRI to identify the type of injury. If the blood supply is compromised, then we will reduce the fracture with a vascular graft because blood supply has been compromised. If there is osteonecrosis of femoral head, then we will do hemiarthroplasty. And if there is a tendency for non-union, we have to do osteotomy. Depending on the condition of the bone, we have to manage the patient. Now let's move towards if the patient is more than 65 years of age, then we have to look at the condition of acetabulum. The normal acetabulum is present, then we go for hemiarthroplasty. And if there is an existing arthritis, then we have to do the total hip replacement. Now let's move towards the other question. The question is a 75-year-old man presents with fracture of intracapsular neck of femur. Neck of femur fracture, intracapsular neck of femur fracture is more than 65 years, that is a 75-year-old man. So, how we will manage it? Let's see the table. Age is more than 65 years. There is no history like arthritis or anything. Nothing is given. Then we will go for normal acetabulum and management of this is hemiarthroplasty. So the answer to this question is option D, that is hemiarthroplasty. Now, the next question is what is the diagnosis of the following X-ray? This is the X-ray given below. It shows this is the femur, this is the tibia, and this is the fibula, and this is the patella bone which is fractured. So the answer to this question is the patellar fracture. Now, the next question is a 22-year-old came with thigh pain. X-ray was done as shown below. What is the diagnosis? Let's see the X-ray here. Here we can see an opening, that is the cloaca. Here involucrum is seen, and in the center we can see the sequestrum. So all these three components are present in osteomyelitis. So the answer to this question is chronic osteomyelitis. Just identify these structures. This is the cloaca. This is the involucrum. And here is the sequestrum. Now, the next question is out of the following, which is the most common site of osteoporotic fracture? Out of the following fractures, that is vertebral, glenoid, subtrochanteric, and mid-shaft of humerus, the most commonly seen fracture in osteoporotic patient is the vertebral fracture. Now, in osteoporotic patients, the fractures are classically low trauma that can be defined as a fall from the standing height or less. So, the most common fracture here is the Colles fracture, that is the fracture of distal radius, followed by vertebra or hip fracture unless the treatment is initiated. Now, the next question is a 70-year-old female presents with extracapsular neck of femur fracture. Now, extracapsular neck of femur fracture means it is the intertrochanteric fracture of the femur. So, what is the best step in management? So, the best step in management of the intertrochanteric fracture of femur is the dynamic hip screw It is used in undisplaced intertrochanteric fracture of means intertrochanteric fracture of femur. Now, the next question is a 26-year-old female presented with proximal one-third fracture of shaft of femur. What is the treatment of choice? So, closed intramedullary nail with interlocking screws is the preferred treatment of most femoral shaft fractures. So, the answer to this question is option A, that is intramedullary nailing. Now, the next question is all of the following statements regarding ankylosing spondylitis are true except let's read the statements one by one. Most commonly seen between the age of 20 to 40 years, this is the true statement we all know. Ankylosing spondylitis affects males more than females. It is also the true statement. In 85 to 95% patients, HLA-B27 is positive. It is also the true statement. And the last statement is non-erosive arthritis of joint with sclerosis is seen. This is the false statement because in ankylosing spondylitis, we see erosive arthritis. There is erosion of sacroiliac joint and later there may be periarticular sclerosis, especially on the iliac side of the joint and finally the bony ankylosis. Now, the next question. So, the answer to this question is option D. That is, non-erosive arthritis of the joint with sclerosis is seen because the question has asked except all of the following are true except. Now, the next question is FRAX stands for. The answer to this question is Fracture Risk Assessment Tool. FRAX stands for Fracture Risk Assessment Tool. Now, the next question. In Pin palsy, that is posterior interosseous nerve palsy, which of the following will be seen? In Pin palsy, finger drop is seen. Okay. Now, the next question is difficulty in standing on one side of hip is due to the problem in which of the following muscle of the other supporting side? So, here it is talking about the Trendelenburg gait and there we all know there is problem in abductors of hip and the abductors of hip are gluteus medius and minimus. So the answer to this question is gluteus medius. And pin palsy, we, finger drop is seen. Now the last question of this series is a 35-year-old patient with complaints of back pain, stiffness, recurrent episodes of eye pain, and redness. On examination, they found to have anterior uveitis and sacroiliitis. Which of the following HLA is most commonly involved? According to the clinical scenario given, we can diagnose the case as ankylosing spondylitis. So, ankylosing spondylitis, HLA, which is commonly involved, is HLA-B27. So, the answer to this question is C, that is HLA-B27. Thank you so much.